Hello, I'm Chris Shettle with WebCME. Thank you for joining us today to learn more about treating diabetic foot ulcers and the importance of proper offloading and reimbursement issues associated with total contact casting. WebCME is honored to have Dr. David Armstrong and Dr. Jeffrey Learman. Dr. Armstrong specializes and is recognized in both the U.S. and internationally for his research, podiatric medicine, podiatric surgery, wound healing, and diabetic limb salvage. He is a professor of surgery with tenure at the University of Arizona. He also co-founded Southern Arizona Limb Salvage Alliance, or SALSA. Dr. Armstrong has produced more than 350 peer-reviewed research papers and over 24 book chapters, and is co-editor of the American Diabetes Association Clinical Care of the Diabetic Foot. Dr. Jeffrey Learman specializes in podiatric medicine and podiatric surgery at Crozier Center for Wound Healing and Hyperbaric Medicine. He is a graduate from the Ohio College of Podiatric Medicine and did his residency at Crozier Keystone Health System. Dr. Learman was recently honored in 2012 as top doctor in podiatry medicine through Mainline Today. We're going to begin with Dr. Armstrong, followed by Dr. Learman, and a brief Q&A session after the lectures.
Ladies and gentlemen, it's a pleasure to be with you today, and what we're going to try to cover in our brief time together is really the length and breadth of a critically important topic that's often underappreciated and under-discussed, but it's really the soul, if you will, of what we deal with every day in the diabetic foot, and that is offloading. And what we're going to talk about together, kind of as a family here, is this. If we look at the overall gestalt, we're going to talk about a logic-driven research that kind of moves along the last generation or so of clinical care and research, utilizing 10 basic questions. That's how we're going to structure this, the real 10 questions and conclusions that have led us here, and perhaps the way forward as well.